Okay, making a video. I just want to show you guys. I find it interesting, and I like visual myself to learn. I'm going to do a visual on pretending that we are giving Cathflo into this catheter. This is a 5 French double lumen PICC catheter. It is a full length. It's 55 centimeters. It has never been used. The ones that we place are usually the PICC nurse is cutting them to fit for the patient. So rarely are they 55. Majority of the time they're like 45, 40, sometimes even into the 30s. So you don't have as much volume in a catheter that's cut. So I wanted to use an example of a PICC catheter that's a complete 55 centimeters. Okay, so I'm going to show you this 1 milliliter. So let's pretend that this patient's catheter I'm able to flush it, but I cannot get a blood return. And so I'm going to clean here. And I've done all the things we've already talked about, probably about moving the patient, moving around, flushing, trying to get some blood return out of that catheter. Okay, so again, this is our 1 milliliter. So watch the tip here. So do remember, pretend that this is the superior vena cava, the PICC sitting in the superior vena cava. The heart is beating, let's say, 60, 80 times per minute. There is actually up to 2 liters of fluid that flows past that PICC catheter every minute. So if I'm going to give this Cathflo, let's see if I can move my hands out of the way, and see if you can see it there coming through. I've got the 1 milliliter. I'm slowly instilling it. Do you see that? I kind of diluted it, but do you see? Let's see if I can move the thing in more. And here's my syringe. I still have quite a bit in here. Remember, this is a 1 milliliter, so it's like a half a milliliter still left in there. See it coming through there? So where is that Cathflo going? If our heart beats 80 times per minute, 2 liters swims by, goes by in a minute, it's in the vascular system. It's not at the tip of your catheter anymore. So when you go to draw back, you're not getting 2.2 milliliters of Cathflo. So that's why when I've told some of you, I like to give it a little. If I'm going to give that whole milliliter or that 2.2, if you just throw it in there, it actually just goes into the vascular system. So if I give a little bit and I've broken down that clot, and then, a few minutes later, 10 minutes later, 15 minutes later, I give a little bit more, I think it helps break down our clots better. So we're still not even done. Look at that, right? Okay, let's say we gave the full milliliter. We gave our full milliliter. Okay, so quite a bit goes in. So you can see why sometimes I just use 1 milliliter in one and 1 milliliter in the other lumen, rather than just giving it all into the vascular space. So, okay.